I did that part right too. So, welcome, folks. We will give folks a second to come in to our room and get settled in. This is our very first meeting for this school year for the Carolina Community Coalition, and we are glad to have all of you here. So we'll give people just a minute to get in. And as you're coming in, if you will introduce yourself in the chat, tell us who you are and what organization or agency or campus you are representing. Make sure you change your chat over to everyone so that we all get to see that in addition to just the panelists. Thank you. All right, folks, thank you for introducing yourself. We will get started. So welcome to the September meeting of the Carolina Community Coalition. It's our first meeting for this academic year. We meet the first Thursday of every month. We're excited to have folks from our campus and from other campuses and other organizations across the state. So welcome and thanks for being here. Like I said, please introduce yourself in the chat. Tell us where you're from and what organizations you represent. We are really excited to kick off our celebration of Recovery Month and our coalition research series with some of our very own graduate students from USC. So I think this might be the first time we've got some grad students presenting in this series. So we're excited to hear about some of the work that they have been able to do in South Carolina. I will remind everyone we are fancy with the Zoom webinar features. So if you would like to ask a question of our presenters, you can use the Q&A function. You can also talk to each other in the chat, and we support that and love that. But we know that if you use the Q&A, we're not going to miss a question or comment that you have. And that might be all the housekeeping. We are recording this and we'll post it on our YouTube channel if you would like to view it later. So with that, I will introduce our speakers. So Maggie and Elizabeth are PhD students studying clinical community psychology at the University of South Carolina. They are also members of the first cohort of fellows in the Supporting Substance Use Disorder Services in South Carolina Center, which is a mouthful, which was developed to address the need for more psychologists trained to provide services related to the prevention and treatment of substance use disorders in South Carolina. Today, Maggie and Elizabeth will be presenting findings from interviews that they and their co-authors conducted with peer support workers providing services across the state. Thank you all so much for being here. We really appreciate all the things that you're going to share. Take it away, Maggie and Elizabeth.
Awesome. Thank you so much, Amy. I'm going to go ahead and start sharing my screen. Elizabeth, can you see that on your end?
Yes, yeah, I'm able to see that.
Perfect. Okay, let me share. Okay, sorry, hold on. Just making sure my screen is fine. Okay. Sorry about that, everyone. All right. Hi again. So as Amy mentioned, I'm Maggie. I'm a fourth year in the clinical community psychology program here at USC. And I was one of the first SUDS fellows, we call our center SUDS, to complete the first year. And I'm very excited to get to talk to you all today, and really just center the experiences of peer support workers. And I'll go ahead and let Elizabeth introduce herself briefly as well.
Hi, everybody. I'm also really excited to be here. I'm Elizabeth. I'm a fifth year in the clinical community psychology PhD program and was also in that first cohort of fellows for the SUDS program. So we're excited to get to share some of our research with you today.
Awesome. So we did want to also acknowledge our other fellows. They put in a lot of work to help out with this study. And unfortunately, they weren't able to attend today, but we did want to acknowledge them. Ellie Wu, Sarah Grace Frary, Wendy Chu, and Sarah Miller all were part of our first year as well. So a little agenda for what we'll be going over today. So I'm briefly just going to introduce the SUDS SC Center, a small background about peer support workers, briefly touch on our study aims and methods, some of our findings, and then next steps that we have in mind. And of course, at the end, we will have some time for questions and discussion to just continue the conversation about these topics. As we're discussing today, again, as Amy mentioned, feel free to use the Q&A chat box to pop any questions that you might have. However, I do want to note that we'll probably address those questions just at the end to make sure we kind of get through the presentation and have enough time to talk at the end. So the SUDS SC Center, just to briefly kind of highlight where we're coming from and the work that we're doing. So the SUDS Center is a supporting substance use disorder services in South Carolina, as Amy mentioned, or SUDS. We are primarily mentored by Dr. Sayward Harrison, who is also on this call. And she is also with collaborators Sam McQuillan and Stephen Herod. Some of the specific aims, as Amy was highlighting for the center, is to really just increase the amount of health service psychologists who are capable and able to work with folks with substance use disorder, specifically in response to the opioid epidemic that we're seeing in South Carolina. So really just implementing this training in our program, building skills to be able to treat opioid addiction and other substance use disorders, as well as this transdisciplinary piece. So collaborating across different fields to really address these issues in South Carolina. So the focus of our study that we're going to be presenting today was really about peer support workers. And I'm sure many of you on this call either work with peer support workers, you might be peer support workers yourselves, you might supervise peer support workers. So you probably have an understanding of who they are, what their role is in your organizations, but we did just want to start out with like a basic understanding of peer support workers so we're all kind of on the same page. So as you may know, peer support workers are individuals with lived experience with substance use and recovery who serve in a structured role, and they wear many hats to support other folks in their recovery community, whether that's providing emotional support, building community and relationships, sharing knowledge and teaching skills. It's really in this more like mentorship position, right, where you're establishing goals, maybe linking people that you work with community resources, as well as advocating for the people that you work with. So this kind of brings us to our research aim. When you kind of look at the research around peer support workers, there's not really much out there. And we were really committed to furthering our understanding of, what are the experiences of peer support workers who help folks with substance use disorder, as well as identify multi-level supports to better assist them in the work that they do. So multi-level supports being, not just things that they can do themselves, but maybe what are some things that organizations can do to better support their peer support workers? What can community members do? What are maybe things we can do at the policy level to support peer support workers, which Elizabeth and I will kind of highlight through some of the things that our participants shared as well. So a little bit about our method. So we had the opportunity to speak with 25 peer support workers in South Carolina specifically. Each one of them completed a semi-structured interview as well as a short survey just to elicit information about where they worked, what were some of their roles and responsibilities, how might this job impact their mental health, what are areas where they might need more support, what are they doing well to kind of cope with the different things that they might do. After that, we transcribed all interviews verbatim, so really focusing on participant voice. We used a more rapid qualitative approach to code our data. And we also had the opportunity to collaborate with a peer support worker who served as a consultant to really help us think about, our study design. Are we asking the right questions? As well as to help confirm some of our findings to make sure, are these representative of peer support workers' lived experiences? So again, as I mentioned, we had about 25 peer support workers, and they're pretty diverse in identities as well as levels of education. I do want to note majority of our peer support workers that we interviewed identified as white. And again, there was diversity in their levels of education as well. But I really wanted to highlight was just the amount of work that they're doing and kind of the different settings that some of our participants came across. So it was just so impactful to see how many individuals our participants were serving within the past month or within their lifetime. So, the mean number of individuals that our participants across all 25 participants was about 38 in the past month. And then over their lifetime, on average, our participants served over 840 peers in their lifetime. And I do want to highlight just the variety of spaces that peer support workers are working in, right? So some of our participants came from recovery, community organizations, Department of Corrections, sober housing, transitional housing, as well. And there are so many roles and responsibilities and so much information that we gathered. And unfortunately, if we had more time, it would be amazing to go over everything. But we do want to highlight some of the main themes that our participants highlighted about their experiences. So on all of our slides, we are going to include some quotations that demonstrate the experiences of our participants. And we do want to note that all of our participants' names have been removed just to protect their privacy. So one of the first things that our participants acknowledged was the work that they're doing and how that impacts their own recovery. And one kind of piece of it is that a lot of peer support workers talked about this very positive impact that the work that they were doing had on themselves. So being able to use recovery skills, knowledge, and resources to teach others. And while they're also teaching their peers, they're also learning from their peers. So there's almost this like co-learning and co-teaching going on together, in which they're maybe teaching their skills peers, but also learning new things from them. Some of our participants also talked about just the compassion and empathy that they gained from being in this role, being more appreciative of the work they're doing in the communities that they're serving. So one of our participants mentioned, if it had not been for my job and having so many people that depend on me, there's no telling where I would be right now or if I would even still be here. The other side of this is that some of our participants also acknowledged kind of how heavy this work is, right? Oftentimes you're interacting with people who might have similar experiences than you. So a lot of our participants acknowledge that the work is very hard at times. A lot of the content that they're talking about is heavy. Some of the things that they might have to do to connect their peers to resources are heavy. But also at the same time, this work motivated some of our participants to not return to use, so they continue to serve as peers. So really finding that this role that they're in had like some kind of life purpose for them that they really were acknowledging. So one of our participants mentioned that it is really stressful, this job. Like it's really fulfilling. It's hard to explain because it's like the most fulfilling job and I would not trade it for the world, but it's also very draining. So again, some of our participants, highlighting these two pieces that kind of coexist of this work being so fulfilling and great, and at the same time recognizing that there are heavy and hard days. Second piece that our participants talked about was impact on mental health generally. So of course, as you know, peer support workers are working with people who might have similar experiences. And a lot of times in these helping roles, there might be some impacts on mental health. And there were kind of two main buckets that I want to highlight here is that a lot of our participants highlighted a very positive impact that this work had on their mental health. So as I mentioned, a lot of them talked about that this role is so fulfilling and it's bringing my life purpose. It increased their awareness of mental health. So maybe not having the language to understand their mental health experiences, but being in this role helped them understand what they might be experiencing, as well as what are their needs to take care of their mental health in this role. One of our participants even shared that I truly love my job. I love my job. And I wake up in the morning and I get out of bed and I say out loud, it's time to save the world. The other piece of that is sometimes it's not always positive. So a lot of our participants talked about this negative impact on their mental health. Oftentimes it's frustrating, maybe having to deal with like systems level things, as well as an inevitable exposure to trauma. So a lot of our peer support workers talked about either witnessing trauma with their own participants or hearing about it through other people, and having to recognize that this is maybe taking a toll on my mental health and my ability to do my job the best I can. So one of our participants really touched on, and then like there's some people that I just can't help. There's nothing I can do and it's just so frustrating. So recognizing that, yes, again, this piece of really loving and enjoying this job while also recognizing that there may be some things out of our control and that's very frustrating. So I'm going to go ahead and pass it over to Elizabeth to talk a little bit more about our finding.
Perfect. Thank you, Maggie. And either way is okay with me if we just leave it on you controlling the slides, or if you would rather. Okay, perfect. We'll go with that. So on a similar topic to what Maggie was just talking about with the impact on mental health, we also asked participants in the interviews about burnout, because we know that burnout is a really common experience for anyone working in healthcare or mental health care, and we wanted to understand more specifically about peer support workers' experience with this. So one theme that emerged was that a lot of the people we interviewed were really good at recognizing their signs of burnout, and some of the most common things that they mentioned were fatigue, apathy, feeling emotionally exhausted, feeling irritable, lacking motivation, or noticing a decrease in their compassion. But at the same time, a lot of the people we interviewed were very confident in their ability to manage that experience of burnout, either because of past experiences or just knowing the skills to use when they are experiencing burnout. So some recommendations that also emerged based on these conversations we had were that organizations would it would be beneficial for organizations to be clearly outlining policies, procedures, and information about the roles of peer support workers, so that it could help prevent unanticipated stress on PSWs. People also emphasized that a supportive climate of peer support among colleagues could make a really big difference, and also being in a climate that encourages self-care was also really beneficial. That was another thing that people mentioned. And then also some people mentioned work flexibility, so having the ability to sometimes work virtually, take mental health days, or take time off when needed. Those were other things that were mentioned, and also having a livable wage to reduce stress associated with meeting their own basic needs. A lot of people also emphasized the role of supervision in their work, that some people had really great relationships with their supervisors, where they could go and talk to their supervisor if they were noticing signs of burnout, and their supervisor could help with reducing their workload in some way, or providing them with some other form of support to help them get through that time. And a lot of the PSWs also talked about boundaries that they had learned to establish between work and home, to kind of protect their own mental energy and mental health while doing this difficult work. So one quote that we thought did a good job of representing some common things that we heard was, I experienced that when I wasn't able to do what I needed to do for someone and was lost all possibilities and just going above and beyond and still not being able to do what I needed for them, that was a burnout phase for me. So this was a common thing that people talked about, that sometimes they worked with somebody who they just felt like they weren't able to help, and that was a clue for them that they might need to think about how to protect their own mental health while doing that work. So we also asked people about various levels of support that they had and resources that they rely on in their work as peer support workers. So the first thing we asked about was any individual self-care strategies that they used. And there were a lot of great strategies that people brought up. So things like finding time to engage in their hobbies, attending recovery meetings themselves, taking time off, spending time with their pets or loved ones, exercise, taking care of their physical health, setting boundaries, being engaged in religion or spirituality if that was something that was important to them. And one other thing that was mentioned by several people was meditation, that they found that to be a really helpful form of self-care as well. And some people, when we asked, is there any kind of self-care that you want to engage in more than you do currently? Some things that were mentioned were more exercise, more meditation and mindfulness, and engaging in more fun activities like social activities were things that people thought it might be helpful to do more of. And then next, we also asked people about any interpersonal supports that they had. So people talked about a lot of different individuals in their lives who provided with them support, including friends, family members, therapists that they were seeing themselves, co-workers, especially other PSWs who could understand the stresses of that work that they were doing, and also supervisors who could provide some professional guidance and also just support them in their work. So one quote that stood out to us in regards to interpersonal supports was somebody said, "It also helps when you have people around you that you can just be open and honest with and that you can talk to about stuff." So fortunately, I have that team here with me. So it was cool to get to hear how a lot of PSWs did feel like they had that support at work of supervisors and coworkers who they could turn to during times that they were feeling stressed. Some recommendations that emerged in terms of what could be better for interpersonal support. Some PSWs did mention that there were some colleagues in work environments that treated them as less than, maybe based on what their training or experience was, and they really wanted to be viewed as equals and treated as equals and be treated with respect. They also described a need for empathy and understanding. So they thought that it would be helpful in some instances for people they work with to understand that they're also in recovery. They might make some mistakes and they need support sometimes as well. And they also described that sometimes family members could be more supportive by giving them time or spending time doing things that they enjoy with each other. And then the next level of supports that we asked about was organizational supports. So one theme that emerged was that a lot of organizations did really make PSWs feel like they were valued as a person with knowledge and lived experience, and as a member of their team, where they were explicitly cared for in their wellness. And another theme that was mentioned was that being paid a livable wage was really helpful. Getting good insurance, having employee assistance services, getting benefits, all really were beneficial. Some people also mentioned that their workplace covered the cost of their therapy or helped cover the cost of their own personal therapy, which was really beneficial for them. And then supervision that they received also is something that was mentioned as an organizational support that was really valuable. So one quote that we thought was a great quote was somebody said, "The board members and the leadership are so good at asking each other, what do you need? What do you need? How can I help? Is everything okay?" So they're very, very engaged in and aware of the fact that someone may need assistance and could be so busy that they forget to ask. And some of the recommendations that were mentioned were that organizations might be able to do some things better to reduce logistical or procedural burdens on PSWs when they're receiving or building up new programs. Also hiring more PSWs so that the work could be spread out across more people. And also promoting understanding and awareness of what PSW roles and responsibilities are so that maybe colleagues are then better equipped to be able to interact with them and really be treating them with respect and as equals. And then lastly, some other recommendations were that PSWs wanted more supportive peer support supervision. So specifically supervisors who also had lived experience with recovery or providing peer support to others so that they could relate on more of those experiences. And then also more mental health supports. So more access to therapy or mental health days or an anonymous line that they could use for support. And then in terms of community supports, people mentioned that having strong connections with other organizations was really helpful because it gave them a network in which they could turn to other organizations for interdisciplinary care and referrals, which was really a helpful thing. Also, people mentioned that in terms of community supports, going to mutual help groups or referring their people that they were working with to mutual help groups could be really helpful. They also mentioned that there were some PSW specific mutual help groups that they attended and that these were a really great source of support. They also noted that having the opioid crisis be acknowledged by elected government officials made a big difference for them, and having communication with government officials really helped them to feel more supported by the community. They also mentioned having some partnerships with law enforcement, like the police or sheriff, and that these partnerships were helpful in promoting harm reduction in a lot of instances. And then lastly, they also mentioned some state and federal funding or grants that helps to support the organizations at which they work, and that some community resources that were funded by state and federal grants were also really helpful. So one person mentioned, we have a good contact with your local city sheriffs, your local county sheriffs, and like I said, the EMS. And we go out and do outreach with them. So I have contacts there. We've got all kinds of different medical providers that have come and done lunch and learn things. So in terms of recommendations for community supports, one thing that was mentioned was the need for post-overdose response teams. So more resources that could be offered to people immediately after experiencing an overdose. They also identified that it would be helpful to have more mutual help groups, especially those that recognize other models of recovery or multiple pathways to recovery, and allowed for virtual options and more resources that aid with social determinants of health. So things like making sure people have access to healthcare and food and shelter and some of those basic things that we all need in order to be healthy. Also, it was mentioned that public education to address the stigma about substance use disorders would be really helpful, since not everybody in the community has a good understanding of what a substance use disorder is. And they noted also that elected government officials or law enforcement could be doing more at times to be supporting the recovery community. And then lastly, they also mentioned the need for greater ease with interagency or organization collaboration or referrals. So sometimes there were a lot of barriers that they encountered when trying to refer people to other organizations or resources in the community. So one quote that we pulled from this was, "I would like to see them, the police, being a little more informed about what a substance use disorder is and what it does to people, and have them just understand that these aren't bad people. I mean, they're sick, they're not well, and you should treat them like they're sick and not well instead of treating them like criminals. But it is the entire justice system is just set up in such a way where they just further traumatize traumatized people." So in conclusion, a few take-home messages from these interviews that we did. The biggest one, if you take nothing else away, is just really the value of peer support workers, that they have a really unique role that not a lot of other people can fill, and being able to share that lived experience with the people that they work with and provide them with support in a really unique and helpful way. Another takeaway was that there are a lot of stressors that go along with this role. And despite those stressors, PSWs reported feeling really fulfilled in their roles and having a lot of resources already that they use to help themselves be successful in helping the people that they work with. And then lastly, just organizations and individuals could benefit and support PSWs by considering the different ways we can adjust individual behavior and organizational policies to align with the recommendations mentioned in the previous slides. So lastly, in terms of our next steps, we are excited to be sharing this work with the community by doing community presentations like this one. Also, we are working on writing up findings in multiple research papers to hopefully get to share that more. And then lastly, we're also brainstorming about future ideas of grants that we could apply to continue this work and further support PSWs and individuals who have substance use disorders. So thank you all for letting us join today and present our work. It was really great to get to share it with you all. And I'll stop in just a moment for questions that Maggie and I can answer. Also, if you have questions but would prefer to reach out over email or another way, our advisor, Dr. Sayward Harrison, we have her email address listed here, and you can also feel free to reach out to her, and she can always put you in touch with us for us to answer your questions at any time in the future.
Thank you so much, Elizabeth and Maggie. So round of applause and great job. Thank you so much for sharing this important work. We are really excited to hear about the work that that you guys have been doing. So I want to add, sorry, I'm trying to do too many things at the same time here. I want Kat, James to introduce themselves. We've added them to the group, and I'm not going to call on folks, but I do see that we have a lot of folks on the call who are doing this work and experts in peer support. And so I'm encouraging you, if you've got questions, add them to the Q&A, but also we're all friends here. So if you want to use the raise hand function at the bottom of the screen, I believe that I can figure out how to elevate you so you can ask your question live. So go ahead, Kat, introduce yourself, please.
Sure. Yeah. I am Kat James. I use the pronouns they, them. I'm the assistant director for Gamecock Recovery at the University of South Carolina. I am a graduate of the College of Social Work here. I am a double Gamecock despite having grown up in Clemson. I'm a cat dad and an aunt, and I'm a person in long-term recovery. So I've been trained as a peer support specialist as well and provide recovery coaching directly to students at USC. And I supervise peer support workers within our Gamecock recovery program. So I'm really excited about this research. Thanks so much for sharing what you've learned with us.
Well, we don't have questions yet. I'm gonna start calling on people if because I know some of you. So Kat, what's kind of some of your reactions to what you heard? A lot of it was very familiar to me in things that we have talked about as we think about recovery coaching within Gamecock recovery. So I'm curious about kind of your reactions. And we know that college students are we're a little different, but we're also a lot the same as other folks. So what are your thoughts?
Yeah, for sure. So one thing that really stood out immediately and that I really appreciate is that it really felt like you captured the duality of this type of helping relationship, that it is both the hardest thing we've ever done and the best thing we've ever done. And so it's just really glad to see that experience that I have had reflected in other people's experiences as well. And yeah, I think a lot of the barriers that you brought up in terms of things that can be done in terms to support folks more, providing more autonomy, more agency, providing funding and support in those kinds of structural ways as well, definitely mirrors what we see here on campus. When we do peer support at USC, in some ways it does take a very different form than folks who might be at a recovery community organization or even, at a healthcare facility or something like that, because have much more of a homogenous background for our consumers, right? Not to say we're entirely all the same, but at least like everybody's in college, which means we've got some similarities. We've got some similar positionality in terms of the resources we have access to for our consumers. But everything you described was like, yep, those are the same kinds of things that we experience on campus as well. So yeah, just overall, every data point you brought up was like, yeah, I see myself in that. I see our program in that. I see our students in that.
I see. I can't tell. I'm going to allow either Sayward or Betsy to jump in. Go ahead.
Let's see. This is Sayward. Can you hear me?
Yes.
Great. Really nice presentation. Thank you so much for sharing that. I'm excited to read some papers coming out of this soon. So I noted that when you described some of the information that peer support specialists shared, that the mean time that they had been in recovery was 3 years, and they had been working as a peer support specialist for a much longer period, like well over 10 years on average. So I was wondering if many of them, if maybe we have that discrepancy because of return to use moments among the peer support specialists, and if any of the peer support specialists that you individually worked with or the transcripts that you read, described what it's like to navigate that really challenging situation of being in that professional role, yet also coping with a return to use moment.
Yeah, that was really interesting and really cool to get to hear people talk about their experience with that, of maintaining their own recovery and having moments of wanting to return to use, and how actually I remember in some of the interviews I did, people mentioning a big reason that they didn't return to use was because they found so much meaning in this role, and that it really, they doubt whether or not they would have been able to maintain their recovery if it hadn't been for their work that they're doing as a PSW. So that was really cool to hear that it was such a strong reason for them to stay in recovery. Maggie, do you have any other thoughts or takeaways that you got from the interviews that you did?
No, I think that that's a great point too, because it also, raises the idea of how people conceptualize and define recovery. And I definitely wish that was something that we got into a little bit more with talking with our participants of how they might define recovery, because that obviously looks different person by person. And, 3 years of recovery and then having a return to use, is that considered still part of recovery? Mm-hmm. It could, but maybe not to someone. So I think that it's definitely interesting to think about, right? Because it's the individual's own understanding their recovery too.
Yeah, that's great. Thank you for those comments.
Thanks, Sayward. I also think I was curious about, you dug a little bit into kind of some of the demographic differences, but did you hear different things from folks who are early in this versus some of the folks with more experience in recovery coaching? Because I think I would hope that folks who've been doing this a while have figured out some of the ways to manage burnout and navigate the secondary trauma, you know, because they've been doing it for so long. So did you see any differences there?
I think not as much. I think something we kind of noticed was there were so many similarities with folks' experiences. I think especially thinking about year, I'm not exactly remembering any differences. But I know a lot of people talked about like being able to recognize after so long, being able to recognize like certain moments where like I am feeling burned out and having like a toolbox of things of like, I know I can readily access these. But we did have like a requirement for all participants to have at least been a peer support worker for at least 3 months, to at least like maybe have gotten like into the organization. But I can't imagine if we looked further, there are probably differences between someone who's maybe just starting out 3 months versus someone who's maybe been doing this for like 10 years, is used to kind of like the systems that they have to interact with and have created kind of their own kind of routine for taking care of themselves. Elizabeth, do you have anything to add to that you notice?
I think that's a really great thing that we probably could look at, because in one of the surveys, they filled out, there was a measure related to burnout, and we did collect that information about how long they've been doing this work. And I would think, I mean, it would seem like logical that if they've been doing it for longer, they will have like developed better ways of managing stress and workload. So we could probably look into that in the future. I think that would be a really interesting thing to look at. Off the top of my head, from the interviews that I did, it seemed like nothing jumped out at me as to like years of experience. I know we had a variety of ages, and it did seem like people who were further along in life, regardless of how long they had been doing the work or had been in recovery, I guess, it seemed like maybe life experience. I can think of a couple of examples where people who are older maybe had more ways of coping, maybe just from having more life experience. But that's a really great question.
It's really interesting as I think about some of our students, and you know, we have talked about kind of Generation Z and the one that's coming next, and they are much more willing to say, I need a mental health day, or I need to take a break, or I'm struggling with this thing. And so I think Kat, you may have something to say on that as well. It just feels sometimes like our students teach us old folks more about how to take care of themselves than I can have to teach them.
Yeah, it's certainly like my experience with it is anecdotal, right? But the thing that I was thinking about from those comments is how much the experience of helping others helps us develop our skills for ourselves as well, right? And so I like those threads of time, right? Like, is this about the amount of life experience we've had, the amount of time in recovery we've had, or the amount of time we've been in a helping relationship? Because really what I see with my students, even, you know, the students who aren't in a formal peer support role with our organization, but who come to meetings and contribute to, you know, the shared knowledge, who share their experience, strength, and hope, as we say, right? And seeing that experience of learning that they have something of value to share with another person really changes the way they engage the next time they hit a major stressor or a trigger or a possible hiccup, right? And so I just really see that experientially being a huge gift when we have that beneficial helping relationship, and we can keep from that total burnout or from secondary trauma that results from it because we are giving too much. If we can keep it in that helping stage, like, I just really think that there's something magical happening there. Just, that's what I see, I guess. And so, yeah, it does sound like there's some of that backed up in your research as well.
You guys and audience, feel free to throw more questions at us. We have a few more minutes. So you can raise your hand or throw it something in the chat or the Q&A. A couple of times heard themes about supervision and experiences with supervision. And I wonder if you guys could talk a little bit about that and what people said was helpful and maybe less helpful when it came to that supervision role.
Yeah, I remember one thing that was mentioned. One participant noted that at one point when she first started, supervision was a very informal thing of just kind of reach out as needed, and that she realized it needed to be a lot more structured than that. And so she talked to like the people, the supervisor in her workplace, and was able to have it become like a routine meeting every week, and that structure was really helpful. So that's one thing that I remember. And I remember people mentioning that some supervisors had different kinds of like career backgrounds or training, that they might not really be able to understand the experience of a peer support worker fully, of being in recovery and helping people who are working on getting into recovery, and that to some degree they thought it would be helpful to have supervisors who were PSWs themselves. So that was another big thing that I remember people mentioning about supervision. Maggie, can you think of anything else related to supervision that you heard?
I think those are some of the main points. I think also a lot of people highlighted just like some of those basic soft skills of like supervisors just asking, you know, how are you today? Like, how are things going? Like, really centering, like, I care about your well-being, like, regardless of like, as if the supervisor is not a peer support worker or not. And just like having a supervisor who's willing to like listen to you and problem solve what you need to do, is what a lot of participants also talked about.
Yeah, I remember people mentioning having a supervisor who would be very like in tune with their emotions and recognizing like, oh, you're overwhelmed right now. What can I do to lighten your load a bit?
It almost goes back to that self-care, right? Reminding people like, hey, it's okay to take a minute when things are tough. Interesting. I think there's a lot of overlap in relationships for peer support workers, right? There's a lot of dual relationships where your supervisor is also somebody you see in meetings, or the person you're coaching is somebody you see out and about. And so I think it was interesting as we make this a profession, right? We're taking something that has been more informal and formalizing it and putting structure on it. And so I think a lot of what you're describing is some of the growing pains of trying to figure out what's the job of a peer support worker, what's the job of a friend, and what do I do when I'm both? And I know we've, tried to figure some of that out, even within Gamecock Recovery, of like, who do you talk to about which thing? So I think that's just part of maybe the growing pains of this profession becoming more formal.
Right. I love that you're highlighting that, because peer support workers wear so many different hats. And it's just like a lot of what we notice is like, even just looking at the research, like what are the peer support workers' roles? Like they do so many different things. And I think getting to like sit down with peer support workers in South Carolina and like asking them, how do you like define your roles? At least will like help with that. But I agree with you like completely, of like, this is just the process of when we're formalizing a role like this of someone who's doing so many different things. So
Right.
If I can kind of throw a plug in, Amy, about Gamecock Recovery.
Yeah.
In addition to our peer support, one of the things that we offer is a boundaries and self-care meeting. In the past, we've called that our family and friends meeting, but what we really discovered was that there were so many students who didn't necessarily need or want to talk about a family member's substance use or addiction, but needed to talk about the way in which these dynamics were impacting their family life. And students just like have a hard time knowing how to set boundaries. I shouldn't say students, all of us, I think, have a hard time knowing how to set effective and healthy boundaries. And so we've shifted that meeting. We call it That's Some BS, Boundaries and Self-Care. And we talk about those things. And so I think one thing that I'm noticing as that group, that meeting kind of gains traction and steam, and we start having more conversations about boundary setting, I'm trying to encourage my students to think about boundaries not as a kind of prescriptive rule about something that the people around us can do, but a predictive statement about how we will respond if certain behaviors come up, right? And as we have that conversation more, to say, like, I can't control what time you text me. I can tell you I'm not going to respond after 9 p.m. until the next day, right? And as we have that conversation more, where we describe healthy and effective boundary setting, the question of, am I your friend right now, or am I your peer support worker, both becomes hazier and becomes less critical. It's a little bit less stress inducing for students, because it's okay within our community, whether you are a friend to someone, whether you see someone in passing, or you are their coach, to say, look, this is something I can't do right now. I don't have the capacity. I'm in class. Can you text somebody else? Any of that kind of healthy boundary setting that we do in caring, loving relationships, as well as professional relationships, I think that makes it work a little bit better, right? And so for me, I think that relationship driven part of it, rather than the like professional, like college of social work was very like, don't tell people about yourself. This isn't about you. This is about them. But as we practice those behaviors, again, we're healing ourselves and we're teaching those folks how it is to live with healthy boundary setting and not let that spin us off into crisis.
Thank you, Kat. Will you also, I'm gonna ask you to also tell us about the Recovery Ally trainings that are coming up in September. But first, if Dr. Harrison is still with us on the mic, I'm wondering if you could tell us what's next for SUDS, because Maggie and Elizabeth were part of kind of the first round of fellows. But what's coming up?
Yeah, so we're really excited to welcome our second cohort of fellows to the SUDS Center. So with our center, every year we recruit new fellows who are advanced PhD students in the psychology department, and we place them into clinical positions within our community to be engaging in prevention and treatment of substance use disorder. So we are launching our second cohort and getting all of their placements ready. Some of them will be placed at Prisma Health clinics doing integrated behavioral care. Some of them will be at recovery community organizations like the Courage Center, where Maggie was placed last year. And that new cohort will also be developing their own research study that they'll work on this year, just as we've heard from Elizabeth and Maggie. And just some other exciting news. We just found out that we received a grant to start a partnership with the Richland County Public Library System, so that we can start to build capacity within our public libraries here in our community to also respond really to the needs that are being created from the current opioid epidemic here in South Carolina. So we're hoping to have a series of films, community panels, also do trainings for library staff so that they can better help their patrons who are coming to the library for resources, who might need to get connected to prevention and treatment services, and even to just make sure that they are, ready and well trained with response, for instance, training in Narcan. So that's an exciting new thing that we'll be launching in the second year. And we're always looking for people to collaborate with, or other organizations to collaborate with, as well as students, undergrad students or other grad students at USC who might want to get engaged with research around substance use disorder prevention and treatment. So please reach out to me if anyone's on this call and here's something that they might be able to connect with us on.
Thank you so much for letting me put you on the spot.
No problem.
Kat, will you wrap us up?
Absolutely. Yeah, so Gamecock Recovery does host Recovery Ally workshops. We focus on combating stigma and misinformation around addiction and recovery. We talk about how to respond when somebody starts to talk to us about their addiction or recovery path. how you can help get somebody connected to resources, as well as how we can each leverage our position and our kind of opportunities to influence the campus culture to make USC a healthier, happier place for folks in recovery from substance use disorder. Our student session is on September 18th. And students can find that on the USC calendar, the student calendar. I'm going to put a link in the chat in just a minute. Faculty and staff sessions for September, we have one on September 25th, which is through the Center for Teaching Excellence. So folks can register on their website for that session. And on September 26th, we have a session through the Office of Human Resources and Professional Development calendar. So lots of opportunities for everybody to get connected with, a group of folks who are coming from a similar background into the conversation. Those sessions are facilitated by students, mostly students in recovery, as well as a couple of recovery allies. We're grateful for that.
Thanks so much. Thank you to our presenters. Thank you to Kat and Dr. Harrison. And we appreciate y'all taking the time to be here and to learn more about what's happening with peer support in South Carolina. We will see you again, in addition to a Recovery Ally workshop on October 5th for our next meeting of the coalition, where I am pretty sure we're going to be talking about bystander intervention and what that looks like on different campuses across the country. So hope you can join us for that. Thank you again to everyone and have a great September.
Happy Recovery Month.